because our pelvic floor is too tight.
Oh.
Or sometimes we leak because our pelvic bones are still stuck in the common birthing pattern.
Wow.
And your pelvic muscles are like stretched like crazy and they can't contract because where they attach to is open. Yep.
Wow. And so
there's
can
definitely
these,
value.
oh, sorry. Can these exercises also aid in like the birth process, like allowing the baby to come out easier?
Yeah, absolutely.
That's a very big part of what we do. And I think one of the services that moms seek out the most, because they really feel like they can't get that level of birth prep in any other setting. You know, even those that go through, you know, midwives and, you know, doing it in that kind of holistic approach will still say, you know, I think that the service that you guys bring for preparation for birth is just that, and, you know, above and beyond. And Dr. Vigo has a pelvis.
Yeah.
And I have
she has oh,
Let me just go grab my pelvis really quick.
Let me just grab my pelvis real quick. Yeah. So I guess the one with the pelvic floor muscles I left at home, but they attach to your sit bones, your pubic bone, and your tailbone down here. And so this is an upright pelvis with a tailbone in the back and the pubic bone in the front. When we give birth, those sit bones come apart, and don't you know that tailbone comes way back.
Right.
Okay. So this space where our pelvic floor muscles exist is maximally stretched.
Wow.
Maximally. So oftentimes when we're done with that delivery process, these bones just come back to where they should be. Oftentimes they don't, and they're either resting apart or the tailbone's sticking way out. And we need to know from head to toe what components have to change to allow these to come to where they need to be. So just one of many things that we address.
Right. So postpartum, we're talking less urine leakage, possibly more spinal comfort, possibly better introduction back into intimacy with your partner. What other positive outcomes do they have after they work with you post baby?
It could jumpstart into a safe core strengthening program. A lot of times postpartum moms don't know where to start. And even before, you know, there's often a pause between giving birth and your 6-week postpartum visit, and moms will be afraid to do anything, right? But there's definitely a lot of work that can be done, even in that early, even in those early weeks and early phases, to give the moms, I don't even like to use a clean slate, but like a nice strong foundation to go back to strengthening.
Right.